Okay, Assalamualaikum warahmatullahi wabarakatuh and good day everyone. So today I'm going to demonstrate about the thigh, okay, the muscles of the thigh. So we're going to use this model, and as I mentioned to you in my previous video that the attachment for these muscles are you cannot really see the attachment of this muscle in this of this muscle in the model because it's not that accurate. So when you get this model, make sure you can orientate yourself, okay? Whether this is the right or the left leg, and how to do that is just by looking at the big toe, okay, big toe. So definitely this is the left lower limb, okay. So well, as I mentioned in my lecture, it's a bit difficult to actually identify all the muscles because it's lumped together, and but you have to find a way how to identify this muscle by looking at important landmarks. For example, like this one, okay. When you have the muscle, the easiest muscle to identify is of course the sartorius. Sartorius. This is a must. Okay, you must know how to identify sartorius. It's a very long muscle, anterior compartment muscle, long, that is attached at the anterior superior iliac spine here, and then it cross to the, from the lateral it cross to the medial, okay, and attached to the, this is the tendon of the sartorius, and it's attached at the upper part of the medial surface of the tibia, okay. So this is sartorius. So now you know that this is lateral. Of course you know already by looking at the big toe, but this is lateral, this is medial, okay. And the next clue to look at is, look at this attachment here. And there's supposed to be 3 tendon, okay, attached at the upper surface of the medial surface of the tibia. Okay, these tendon are called pes and serinus. Pes and serinus, where there are 3 muscles. The first one is the sartorius, and then followed by the gracilis, and then followed by the tendon of semitendinosus. So these 3 tendons, okay, they attach at the upper surface of the medial, upper part of the medial surface of the tibia. So then you trace backward. So you know already the sartorius, you trace backward. Okay, now you can see the gracilis. Okay, the gracilis is at the medial part. It's a muscles of the medial compartment. And then you can trace the third muscle, the most posterior muscle that attached to this pes and serinus, that forms this pes and serinus, is the semitendinosus. Okay, semitendinosus. So when we label here, don't be confused lah. You just trace downward to the attachment. So this is semitendinosus. And besides semitendinosus, you have the semimembranosus. Okay, semimembranosus, trace downward, you can see that it is attached at the medial condyle of the tibia. A different attachment. So usually students are confused between these two. I don't think that you should be confused because you know the attachment, the pes and serinus, then you can trace upward. Okay, so that is number 1, how to identify. So you can identify these muscles here, okay. And if you want to go backward, okay, after, apart from semimembranosus, you can see another muscle. There's only one more left in the posterior compartment, which is the bicep femoris muscle. And there should be long head and short head, but in this muscle, if you just look from external, you can only see one bulk of muscle. And then this muscle, actually long head and short head, they attach together at the fibula. Okay, at the fibula. Right. Before I dismantle this muscle, let's have a look first, okay, on the general overview when they are together, okay. Alright, so this is the sartorius just now. So next, let's have a look at the muscles of the anterior compartment. Okay, apart from sartorius, this is another very prominent muscle, which is the rectus femoris muscle. Okay, rectus femoris muscle. And you can see that this is clearly, you can see it is attached to the patella via this quadriceps femoris tendon. Okay, quadriceps femoris tendon. And then you know that this is medial, this is lateral. So this is vastus medialis, this is vastus lateralis. Okay, of course you cannot see the vastus intermedius unless you take this out and look at beneath the muscle is the vastus intermedius. In terms of attachment, insertion, I said it's very difficult for you to learn from this model. So look at the complete anatomy software and try to play around. Okay, but remember, if one trick that I can give you, if for the vastus medialis is attached to the medial surface, a medial lip of linea aspera attached to medial spiral line. And then if you just trace upward, okay, and intertrochanteric line, okay, it's just like a straight line. Whereas for lateral lip, it is lateral lip of the linea aspera, and then it has gluteal until it goes until gluteal tuberosity, okay. And for medial also, it also attached at the medial supracondylar line. So it's just like a straight line. Just look at the femur and then you can see very clearly the attachment. Alright. Another muscle that you can look from here is this. This is not the thigh muscle. Okay, this is not thigh muscle. It's considered part of the gluteal muscle, right? Okay. So this is the iliotibial tract, which is the modification of fascia lata. Okay, fascia lata. Okay, this muscle is tensor fascia lata. Right. Okay, now let's remove some of this muscle so that you can see the medial structure. Okay, let's remove the sartorius first. Okay. Okay, now you can see the adductor, right? Okay, right. So you have here, so this is the adductor longus, adductor longus, and this is the pectineus, okay, because it is attached at the pectineal line, but of course you cannot see the attachment at the femur, pectineal femur. Remember, adductor longus here is on the same plane with the pectineus muscle, okay, they are in the same plane with the pectineus muscle. Alright, this is the semitendinosus, semimembranosus. Okay, now you can see another muscle here. This is the gracilis just now, gracilis, and we have removed the semitendinosus, semimembranosus. So there's one muscle here, hamstring part of the adductor magnus. So you can see that. I think that's all. Okay, I think that's all. So thank you so much. Assalamualaikum warahmatullahi wabarakatuh.